2, 1, 2, 1, 2. Can you hear me?
Are you taking Phil's
1, 2,
1,
1, 2.
or? Are you taking, oh, thank you. Do your magic. All right, the governor's coming.
Good afternoon, everyone, and thank you all for tuning in. We're going to start this afternoon's briefing with some words from Dr. Levine. Dr. Levine.
Thank you, Governor. I'd like to give you a little bit of an update on where we are in Vermont. Over the weekend, the numbers did have a spike upwards, and now we've gone from 52 to 75 positive tests in the state. Unfortunately, and we send our condolences to all of the families involved, our deaths are now 5 in Vermont. There were 3 additional deaths over the weekend, all relating to the outbreak at Burlington Health and Rehab. When we look at the data, there's clearly trends. As we've increased our test capacity, we are having more positive tests. That should not be a surprise to anyone. And countries that long ago had higher test capacity saw this happen reliably. Many of our tests, other than those that we've termed the highest priority, which remain in our state public health lab and have a rapid turnaround time, many of our tests are now sent out to commercial labs, and we've begun to see some of the results from those test results. And a number of the positives, excuse me, are in that group, and to us that indicates that we're seeing more sustained community transmission of COVID-19. Since I know I'll be asked about this, I thought I'd give you a brief update on the situation at Burlington Health and Rehab. Total number of patients that had positive tests were 14, and only 1 staff member. We've been actually doing a lot of proactive additional steps to bolster what the facility in reality is and was already doing. We found no fault in their infection control practices or procedures. We've advised them on them. We've observed them. There are various aspects of how they cohort and separate patients with different risks and different test results, and they're doing that very well. There may be an opportunity in the very near future to have a select group of patients leave the facility, ones that were not there for the long term, so to speak, were there more for the rehabilitative aspects of their stay. Staff are all being asked and required, as our own staff have found out, to have their temperature checked as they go into the facility. And obviously, if they have a fever of any sort, They don't go to work then. We've been in touch with the CDC innumerable times. Most recently, I was on a call 9 o'clock last night, and we continue to hear their guidance. They continue to tell us that we have always been following their guidance and that we're doing a fine job. And they have no desire to come here because, as I've said before, they have numerous outbreaks across the country in long-term care facilities as a result of the COVID-19. My last comments will just be more philosophical, if you will. This is really an unprecedented time. We've asked Vermonters to socially distance. We've asked Vermonters to change everything about their lives in a very, very constricted period of time. I can tell you from my own observations, and I had to go out and do some errands yesterday and buy some things, and people, even when they recognized me, were respectful. They did not come up to my face to talk with me. They spaced themselves appropriately. They understood that. I know we're not hearing that in every quarter of the state and every person that lives here, but I do see remarkable change in a very, very short period of time, which I think is commendable. You know, in public health, we use some terms that don't sound so good in this kind of atmosphere, like isolation and quarantine, you know, segregating a portion of our population. And when we say terms like social distancing, they don't sound maybe quite as negative, but they certainly don't sound very inviting either. And so I want us all to remember that, you know, when I talk about public health problems in Vermont, I also talk about them sometimes that their root is in social isolation. We're not looking for social isolation. We do want people to be physically not as connected with each other as they were, but that does not mean that they need to be socially isolated from them. And it really means that all of those creative ways in modern technological times that we connect with one another, we need to take advantage of those more than ever before. And it's our goal at the health department, and I think as a state, to really try to help our population with that real difficult challenge of staying connected with one another, helping one another, being cooperative, but at the same time, having that sense of volunteerism and creativity that will really help us all get through this. With that, I'll turn it back to the governor.
Thank you, Dr. Levine. As the doctor just outlined, as we all expected, we continue to see a rise in cases as we test more Vermonters, and we know these trends will continue. On behalf of all Vermonters, I give my deepest sympathies to those who lost loved ones due to this pandemic. That's why our mission has been to do all we can to slow the spread of the coronavirus. Reality is, many will be affected, infected, but will only experience moderate symptoms. But the conditions are much more severe, and the risks are greater for the elderly and those with chronic health conditions. Precautions we're taking are to protect our loved ones and neighbors who face greater risks. And to win this battle, we have to do our part, all of us. It's literally in our hands. At the state level, we've done a lot to make sure people are social distancing, including limiting the size of social gatherings to 10, dismissing schools, closing daycares, restaurants, bars, gyms, hair salons, and much, much more, as well as other efforts to slow the spread. As I said last week, we're going to have to do a lot more before this is over. And I want Vermonters to start preparing for even more difficult measures. We're now entering a new phase as we try to flatten this curve. Today I signed an order to require businesses and not-for-profits to implement every work-from-home procedure they possibly can so their employees can stay home safe. Vermonters should also expect additional steps very, very soon that will further reduce contact and direct more to stay at home in order to slow the spread. It's not a question anymore of if, it's a question of when. To be clear, all of us should already be taking personal responsibility to physically distance ourselves from others and to follow the guidance in place to help keep each other healthy. The state is further preparing as well. For example, I've directed the National Guard and our state med-surg team to work with the state EOC to stand up the first of 3 medical surge sites. While we hope we don't have to use them, we must be prepared for this possibility. I know the actions we've taken and those yet to come are difficult, which is why we're also expanding unemployment benefits, helping small businesses with emergency loans, and other initiatives to help support people through these challenging times. But we know government doesn't have all the ideas or solutions. It never has, it never will. And just like during Irene, it's the ingenuity of Vermonters, the creative spirit, the energy and work ethic of our people that we need now more than ever. Here's what I'm asking of businesses and nonprofits. If your organization is still open, look at our needs and ask yourselves, what can I do to help? There are still important jobs that need to be filled. So it may take some creativity and flexibility, but finding ways to get things done while social distancing can make a big difference. We're seeing this across the state, from businesses finding ways for employees to work from home, to restaurants with curbside pickup and grocery stores creating special hours for the elderly to shop. And we're seeing generosity as well. Last week, I put out a call to private companies around the state asking for donations of personal protective equipment for our healthcare field. By the end of the week, Casella, Edlin, General Dynamics, Global Foundries, Pompanusic Mills, the Church of Latter-day Saints in Sharon, and the many others had answered the call with donations of masks, gowns, and monetary contributions to protect our healthcare workers. As another example, the Vermont State Police, with the support of local businesses like Cold Hollow Cider, Twincraft, and Autumn Harp, have been producing hand sanitizer. And I know we have a few distilleries doing the same. And the Williston Fire and Police Departments are giving Facebook Live tours of their equipment to entertain kids learning from home. The point is, this is the time to tap into your creative spirit, which is in the DNA of every Vermonter. To everyone across the state, this is an opportunity for each of us to step up and join together, even as we must be physically separated. We can unite to help those in need, and we need everyone to think outside the box and find creative ways to do that. Pick up a meal for a neighbor, provide books or other resources for young kids, or make a video to read to them. Send cards or messages to your local senior center, or donate to a local charity like the Vermont Food Bank, Meals on Wheels, along with so many others in need. And by the way, when you order takeout, make sure you tip them well. They could use it. We need to take bold actions to defeat this pandemic, but we also need small acts of kindness and goodwill as well. This will deepen our resolve, preserve our faith, and strengthen our connections to one another. We cannot allow the physical separation to pull us apart. Instead, we need to use this moment in time to come together in other ways. So today, I'm asking you for your help. And here's your mission. Help your fellow Vermonters in their time of need. And I realize much of this is already happening. But just like government needs to do more, we need each of you to do more as well. That's how we're going to get through this and put Vermont in a position of strength when this is over. Because it will be over at some point. It may be a long haul, but it will happen. All the small initiatives and acts of kindness make a huge difference. The bottom line is we need each of you to find a way to help, to contribute in whatever way you can, to help pull us together. Stand united as Vermonters. I'm so very proud of this state, and I know we're going to get through this. Not because of any one person or any one action, but because of each of you. So with that, speaking of partners, I'm very pleased to have Congressman Welch here with us today. Senator Sanders, and Senator Leahy, who I spoke to just before I came down for this briefing, have been very supportive of our work and leading additional efforts to help Vermont at the federal level. So now I'll ask my friend, Congressman Welch, to say a few words.
Thank you. Thank you, Governor. Thank you, and thank your team. Thank the Guard, retailers and grocers, and thank you, Vermonters. The Governor has been speaking about what each of us can do in what appears to be an overwhelming situation, and the message that he's giving us is that any action we can take that helps ourselves, our family, our neighbors, that's an action worth taking. But there's also an action that the federal government has to take. This is an unprecedented challenge. We have a pandemic, and the recommended way of protecting our health is to compromise our economy. People can't go to work. Businesses are closed down. People who had a job now don't. And we know that we've got to take the steps required to protect our health. We've got to do it no matter how painful they are. But we also have to be looking over the horizon to address the economic challenges that we've had to suffer in order to protect our health. And Washington is the site of the federal government, and that federal government belongs to the people of this country. And if ever there was a time where it had to act on behalf of everyone, it's now. The main responsibility that the federal government has is to provide the funding so that our families are secure, our hospitals are secure, and our businesses are around to fight another day. The job we have is complicated and difficult, but it's not as hard as the job that the frontline health responders have. It's not as hard as the job that a family has where they were working and the mom or dad comes home Tuesday and says, I don't have a job any longer. It's not as hard as those folks showing up at the hospital knowing it's a risky environment where they've got to provide that health care. That's what is going to ultimately sustain us. But we have a job in Washington to be the banker of last resort. And the legislation that we're now considering, up to $2 trillion, has as its focus 4 things. Number 1 is individuals. How do we protect individuals? I spoke to the head of the Farmhouse Group, very successful restaurateurs. They went from having 250 employees on Monday to 4 employees on Tuesday. Think about what that means for the security of those families. So we want to extend and expand unemployment insurance and add about $600 on top of what the maximum is, which the governor tells me is a little over $500 here. Have that on insurance apply to folks who are independent contractors, that's your Uber drivers, and to self-employed, folks in the past who've not qualified, but whose incomes have collapsed. There's discussion about direct payments to individuals. And that may be included, and if it is, I'd be glad to support it. But I actually think doing something that's sustainable is better than doing something that's one time. If a family has an income of $50,000 a year, a $1,000 check is 1 week. And this is gonna go on longer than that. That may be part of it, but that's why I believe that expanded unemployment insurance paid for by the federal government is really essential to provide some stability to individuals. We've got to improve food security. All those kids and all those seniors who are dependent on those meals have to make certain that the regulations that would prohibit them from getting those meals when they're not in school are swept away. I know the state's working on the delivery of those meals for kids. But that is something that's really essential for lower income Vermonters. There's also a desire to have a moratorium on debt repayment for 3 months. Folks with credit card bills and the interest mounts, those late fees are brutal. Students who are in the process of repaying loans, those interest rates are tough. Car loans, all of these things that are everyday obligations that people have and they meet their obligations are now a real challenge, and we don't want those families to come out on the other side of this with ruined credit and no opportunity to get back on their feet. Small businesses. I've spent a lot of time the last several days on the phone with owners of small business. I mentioned the Farmhouse Group. But there's just a very vivid, real example. There's a restaurant in Norwich where Margaret and I have dinner like once a week. It's like our date night. And Bruce had to lay off his 14 people. And what he's doing now is doing takeout meals. And I like your idea of tipping. But I also like the federal government doing a little bit more than that. I like the federal government giving a loan to Bruce and small businesses that can become a grant when he uses that money to maintain his payroll. Because one of the challenges we face with these small businesses that are so essential here in Vermont is that when the lights go back on, when we can go back into those places, where will their workers be? In some cases, they won't be here. So we want to make it possible for them to open those doors on that day when it's okay, public health-wise, to go back. Third, our hospitals. Our hospitals are so essential to getting our folks through this and essential to our way of life here in Vermont. Our community hospitals are vital institutions, as is the medical center. They're under enormous strain. Why? They have been told and required to essentially stop elective surgeries. And for our hospitals, by and large, the difference between red ink and black ink are those elective surgeries that are part of what they do. Why do they have to withhold on the elective surgery? It's because we don't have the mask and the personal protective gear that will be necessary as the surge of patients with the virus start entering into the hospitals. So their financial situation has nothing to do with any business practices of theirs. It has to do with the federal situation we face of this virus and having to have these hospitals be available for when those patients come in. So we're having a discussion now with a bit of a debate about whether that should be a $75 billion or $110 billion payment that's available to stabilize the finances of these hospitals that are helping us get through this. That would also include finally trying to get enough personal protective equipment that's essential, in testing equipment that obviously is essential. And then finally, we have to have state aid. The federal government has to help our state partners. Governor Scott and his team are on the front line. And the cost to Vermonters as taxpayers is going to be significant. We believe, Patrick, Bernie, and me, that really the federal government should be the one that's paying the expense associated with what is in effect a national emergency. We can't impose that and shift it to a state, any state that's already overstretched. So I hope we're able to deliver on that, Governor Scott. And then finally, we've got to have oversight on this. I mean, it's not that the mistakes will be made when you're doing something as quickly and as momentous as this. But on the other hand, that's no reason to not have accountability. So that's the approach we're going in. There's differences among legislators about how best to do it, but there's a consensus that we have to do it. And I think there's an emerging consensus that to the extent that the federal government is involved, it has to be the payer of last resort. We can't impose this on the states, on the communities, on the small businesses, on the hospitals, on the individuals who are all rallying to meet our public health crisis. So thank you, Governor, and it's a pleasure to work with you and your team and to be a small part of trying to help us get through this. And now I want to introduce the head of the Vermont Retailers and Grocers Association, Aaron Segrist. I really appreciate what you all are doing. You're on the front line, keeping us fed. God bless the retailers, and God bless our healthcare workers. Thank you for being out there interacting with the public at a safe distance. Thank you, Aaron.
Thank you. Thank you very much. I am Aaron Segrist, president of the Vermont Retail and Grocers Association. It's incredibly difficult to follow such steady and fantastic leaders today, but thank you both Congressman Welch as well as Governor Scott for joining the association and encouraging consumers across the state to remain calm, and thank you for your leadership during this time. Last week, the Vermont Retail and Grocers Association sent around the state word to encourage retailers and grocers of all sizes to designate specific hours for vulnerable populations, to provide, as well as provide alternatives to shopping, such as curbside delivery or even home delivery in certain aspects. We also continue to encourage consumers to please respect these designated hours. You can find a growing list of those businesses providing designated hours or other shopping alternatives on our website at vtrga.org. We're doing our best to make this list as comprehensive as possible. It will change throughout the day on a daily basis, but please again visit vtrga.org and you will be able to find stores within your communities that are providing designated hours as well as alternatives to shopping. We also would like to take this time to urge customers to remain calm. I understand that these are uncertain times, but we're all trying to do our best to get through this as best as we can. We ask that you take a little bit of precaution where necessary. We need to rest and reset and remember that the food and other necessities are available. And we ask that customers go back to shopping as you used to, in the sense that we ask that you don't hoard. We ask that you shop for 2 weeks, which is recommended by the CDC. Again, 2 weeks instead of 2 months. The shelves were stocked and plenty of food was available when we were shopping before this uncertain time hit. If we continue to buy more food and toilet paper and supplies necessary, it limits the ability of our neighbors to remain safe and healthy as well. Again, the shelves may look empty at various stores, but food and other products are available. We urge everyone to refrain from purchasing more again than 2 weeks at each visit. It's imperative that we revert back to how we used to shop. Additionally, grocery stores especially are on the front line during this pandemic. If you're sick and you go to the doctor, it's a controlled environment, and everyone involved is able to take certain steps to protect each other. We don't have that luxury on the front lines. We don't know if someone is contagious, and so again, we ask that customers who may feel unwell, please stay home. And we are here to share with you that stores are providing alternative methods to shopping and doing everything they possibly can to ensure your safety as well as their employees. And finally, because we don't have the luxury in stores to know if someone is contagious, we've implemented additional steps to ensure again that you are safe. Additional cleaning throughout the day, plexiglass guards at certain checkouts around the state. Employees are wearing gloves where possible. However, we all know that there's a shortage of personal protective equipment. It's inevitable that stores will have employees that will become infected. And this is again why we are asking that you practice the CDC guidelines and understand that these grocery stores especially are doing everything they can to protect the public and employees. If an employee becomes infected, Stores are already doing everything they possibly can to ensure that they don't, but if they do, they're working hard to implement practices to ensure that they are disinfecting as quickly and swiftly as possible. We ask that you understand that this is inevitable. We ask that you understand that that the true Vermont spirit is also neighbors helping neighbors, and we will get through this. We all just need to rest and reset. Thank you again for our leaders up here. Thank you, Governor Scott. Thank you, Congressman Welch. We certainly do appreciate your support during this time.
Thank you, Aaron, and thank you members for us. Typically in a crisis or an emergency, we think of the first responders as typically the police, the fire, and the EMTs and so forth. But in this crisis, I think we have to add a couple, and I would add those in the grocers that are providing the food that we need, as well as the custodial staff that is providing a need for us as well to make sure that we're protected. So in different times, we have to look at different people for help, and I'm happy to see that they've stepped up. We'll start with questions at this point in time.
Great, thanks. Again, for those on the phone, please wait for your name to be called and then hit *2 to unmute yourself. We are a little rushed on time, so please try to answer questions that have not been asked before. I'm going to start with Joe from the Barton Chronicle.
*2, Joe. Maybe we'll come back to Joe.
Alex, Journal Opinion. *2 to unmute yourself. Ann, BT Digger. *2.
I'm assuming we might have a problem.
I heard it really faintly there.
It's the
So
volume
you
up.
might-
It's
you
up
might-
all the way.
Ann, BT Digger.
Why don't we
I'm going to
take?
keep going. Let me try Wilson, AP. *2 to unmute yourself.
Why don't we take questions to start off with while we try and fix this issue?
Sure. Start with you, Kat.
All right, Governor, is there any sense of how to quantify how much our economy has already idled because of this? I don't know if you can do that either as a percentage of the economy or the number of people.
Yeah, very difficult at this point in time to determine, but suffice it to say, these are going to be very challenging times for our economy. That's why I'm so grateful for some of the approach Congress is contemplating. This will be necessary to take care of our workers.
Can you hear me okay?
I can now. If you could just hold for just a minute, Ann.
Can you hear me okay?
Ann, if you could just hold for a minute. That's why I'm grateful for the congressional delegation and what they're proposing. This will be a tremendous boost for us. It's going to be a very long recovery in some respects, but with their help to put a reset on where we were before would help us incredibly.
So we don't, though, have a number from the tax department?
Not at this point. I mean, there has been all kinds of projections, but I'm not sure that anyone can determine that because it really depends on how long. If some had said in the beginning that this was going to be a short period of time, maybe 2 or 3 weeks, but this is not going to be 2 or 3 weeks. This is going to be for the long period of time, months, I believe, before we're even through the initial surge. And then at that point, it's going to be a slow recovery. So it could be a long time.
Ann, BT Digger.
Ann from BT Digger. let's take
Okay.
another question from the
Brittany?
floor.
Right here. So, you said that we need to be preparing for more difficult measures. Would a stay-at-home order be something we should be preparing for?
Yeah, I think when you're looking at what other states have done, we have the luxury in some respects of seeing in real time the epicenter, which is in New York, certainly what New York and California, New Jersey, Connecticut, and others have done is going to be fairly widespread, will be coming next, I believe, as well as our neighbors. I'm in constant contact with Governor Sununu, Governor Baker, Governor Hogan, and others, and watching again what other states are doing in order to determine when the right time is to do this as well. Speaking with Dr. Levine almost on an hourly basis about what we're seeing on the ground here. Everything's based on data and science. We took a measured approach going into this, and once we get to a point where we're on the other end, we'll take a measured approach as we proceed to recovery. So this is what we're contemplating.
Hi, can you hear me okay?
There's no specific timeline, though.
Oh, it's going to be, again, not a question of if, it's going to be a question of when, and I would expect it will be in the next couple of days. We want to give people, I think it's important, what we've done thus far in giving people time to prepare emotionally, mentally for what's happening, and making sure that we're ahead of the curve in what we're seeing. We're taking all the data in, and again, we think we've done this correctly, and we're just making sure that Vermonters are prepared for what's next. Once we prepare them, and they see that stake in the ground, they're prepared to do whatever's necessary to get through this, and that's what we tried to do. Take a really measured approach to this crisis.
Stuart?
I was gonna ask about that. Can you talk a little bit about the nursing home facility? Are other nursing home facilities, other long-term care facilities at similar risk now? Is there anything that others can do and learn from Burlington Health and Rehab?
Yeah, I'm going to let either Dr. Levine or Secretary Smith answer this, but I will say, as I've said from the very beginning, we know the elderly, those with chronic illnesses, are at risk, all of them. So we know that our nursing home and long-term care facilities are something that we try to protect, and will continue to do so because they're the ones who are at most risk. So, Dr. Levine? Or Secretary Smith?
Mike Smith, Secretary of Human Services. As you know, when the governor issued the state of emergency, we really clamped down on access to nursing homes and long-term facilities similar to the Burlington Health and Rehab. We clamped down very strongly on visitation and that sort of access to it. So we started initially with that in terms of no visitors except in end-of-life situations, no visitors to that facility. And yet you see how severe the situation is when you have an epicenter in a facility that is that has people that are elderly. This is what is the issue here for those who don't take this seriously. This is the seriousness of it. This disease does not affect, it has limited effect on 80% of the population in terms of moderate to mild symptoms with this disease, but it has tremendous effect on those that are older and elderly. And that is something we have to protect. That's why we put those restrictions into place to begin with. I'll leave it to Dr. Levine to expand on that.
Well, just briefly, so visitation policies are critical, and they're spread from not just the long-term care facilities, but hospitals, other acute facilities. Second is the workforce, making sure that the workforce is healthy, making sure that no one in the workforce feels uncomfortable staying home, that they might lose their job or what have you, because the fact is no long-term care facility wants to have a problem occur like we're seeing now. And workers take personal responsibility, which is some of it, to stay home. And as I pointed out with the current facility, you can't even arrive to your job if your temperature hasn't been taken at the front door. So those kinds of policies are really, really helpful. I would add that we have no reason to believe at Burlington Health and Rehab that neither a visitor nor a employee was the reason for this to have occurred. And we're trying to do some of the detective work behind that right now, but there's nothing obvious that has come up related to any policies.
Have all the staff and residents there been tested?
The appropriate ones have been tested.
But not everyone?
Not everyone.
Can you give us a sense of how many, what percentage of staff and residents have been and have not?
No, I can't because I don't have the total number of staff.
I have the second one since we're able to ask another one. We've been hearing a lot of emails from people who are concerned about a lot of people coming into Vermont to stay at their second homes, trying to get out of places like New York City. Are we doing anything to assuage those fears that some people have that people might be bringing the virus in from places like big cities?
Yeah, I mean, the reality is we're all in this together across the nation. We're trying to do whatever we can to socially distance ourselves, but we've taken, we've had a lot of second homeowners over the years, and they pay, they have their homes, they utilize their services, we provide them with all kinds of things, and they provide us with all kinds of income as a result. We're not going to turn our backs on them, but certainly we're discouraging folks from coming to Vermont to escape what they have had to endure in their own homes, hometowns, and villages. But at the same time, once they're here, we're going to take care of them. And we're all in this together as a nation, as a humanity. We have to stay together on this.
And it's worth saying there's sufficient community transmission occurring right now that it's throughout the population. It would be very, very unfair to point a finger one way or another. Think about all the travelers who have come back from vacations in European countries at a time when our country allowed them to just come through the airport and go home. We could blame all of them as well. But this is a worldwide pandemic, and this is how pandemics evolve. It does call for perhaps, though, a coherent national policy, I would say, so that state by state, each state didn't have to sort of invent their method for social distancing and try to make that work for their population, because we know that viruses have no respect for state borders. And we know that our borders with New Hampshire and Massachusetts are very fluid, and there's a lot of commerce that occurs across those borders, and people don't even know they're crossing a border when they go to their favorite restaurant or what have you. So it's very challenging if a region can't have a similar policy across the region to really have the ultimate in success with these kinds of social distancing mitigation interventions.
Yes.
I have another question for Dr. Levine about testing capacity. You spoke earlier about the increase in testing capacity, the ability to send tests out of state. How is that affecting the turnaround time? Like an average Vermonter who goes and gets tested, when can they expect to get results back on that test?
Yeah, so from the state lab, they can definitely expect within 24 hours. From the send-outs, it's a moving target. So we've gotten some back very quickly. We've gotten some back in 48 hours. People are telling us they're being told 4 days, and I haven't seen that play out yet, but we need to watch that closely.
We have had readers contact us and say they've waited 4 days or more.
Yeah.
What can be done about that?
Right now, increasing the capacity of the local labs that we have here, which means having all of the appropriate reagents and extraction devices that are needed, having the appropriate number of collection kits, working very closely again with our partnership at UVM Medical Center. All that will help enhance our opportunity to have a very rapid turnaround.
Are there?
But I don't want to throw the commercial labs under the bus because they're indispensable now in our ability to do surveillance on this evolving epidemic and really get a handle on things and allow people to identify themselves as afflicted or not afflicted and take the appropriate steps.
We also know there are a lot more samples being collected at more locations around the state. Are those all getting actually tested at the same pace? Or are we looking at some kind of a bottleneck right now where there's more samples coming in than we can test on a given day?
No, but see, so the high priority ones are staying here and the lower priority ones, and there's a specific guideline for who is higher and who is lower, are being sent out. There was, in the very first day or two, a backlog in terms of we didn't know where we could send them at that point in time. Now there's a very fluid, smooth process to get them in and move them out.
Time for a couple more questions. Sorry, we have Brittany and then Stuart.
Governor, just a quick question. Have you been tested for the virus yet?
I have not. I have not had any symptoms. Obviously, I'm doing everything I can, watching myself and making sure that I'm washing my hands dozens and dozens and dozens of times a day, and making sure that we're staying away from each other. But I haven't had any symptoms at this point.
Stuart?
Governor, could you just clarify, we can expect a shelter-in-place order from you in the next couple of days?
I would not describe it as a shelter-in-place. That terminology means something different to many people, especially in the emergency world. What we're going to advocate is just what we've done thus far, and it'll probably take another step. But we want people to stay at home when they can. Right now, you have a responsibility. If you can stay at home, stay at home. But we're going to take further measures to make sure that those that can or should are, and that we're allowing some of the essential services to continue.
And can I just follow up? Is there anything you'd like from the legislature tomorrow as they try to cobble together a session?
Yeah, we've been working hand in hand with the legislature, and I want to give a lot of credit to them. They're trying to take care of whatever needs we have at this point. We're going to need some more. There's all kinds of issues that will need their input, their actions, and we'll continue to do that. So I really appreciate. We've again put whatever partisanship, whatever debate we have aside to do whatever we can together to help Vermonters. Yeah, sure.
Right. Just on, you asked the question about the economy. This is where the federal government has to be aggressive. Secretary Mnuchin indicated in a conference with the Senate that we could have unemployment of up to 20%. And it's only the federal government that has the capacity to respond in a big way that's going to help our states, our small businesses, and our individuals get back on their feet. And my view is this is a situation where it's much better to do too much too soon rather than too little too late. And I hope that is a view that prevails in Washington. But I want to thank you, Governor, and all of Vermonters who are on the front lines.
Again, that'll wrap it up. We'll be back with you on Wednesday. If anything else comes up, we'll certainly gather again in the meantime. As we've done throughout this last 3 weeks, we react when we need to, when we see the data and the science telling us what we should be paying attention to and what we need to do immediately, and we've done so. So stay tuned. I want to apologize to those on the line. We'll figure all this out, and we'll make sure that your questions are answered. Thank you.